Ja, så där ja. Välkommen allihopa till det här lite försenade webbinariet. Vi släpper in Sue Mailer och börjar med, och hon kommer att prata på engelska och köra sin presentation här. Så om det kommer några väldigt svåra ord och så kan ni skriva det på chatten, så kanske ni kan få en översättning. So please, Sue, start your presentation now.
I am so sorry
No.
for whatever's been happening, and I really apologize if it was anything to do with me. But I thank you very, very much for inviting me to speak. I'm going to focus on repairing damage in muscles and the role of physical functioning within that remit. So I guess with this talk, what I really wanted to do is make sure that we bring the focus back to the patient. Often when we hear presentations around myositis and its treatment, there's a lot about basic science and clinical science and pharmaceutical science. And I guess what I wanted to come back to is, you know, how can we put this all back into something that's very appropriate for the patient, but thinking about physical science, thinking about muscle repair and exercise, strength and functioning, and then thinking a little bit about how that impacts psychologically and on life functioning. So bringing all of this together in a very biopsychosocial model for the patient in particular. So I guess the goals for, you know, most people would be to feel better, to be able to do more, and to have more control over what happens to them. Quite often when you're involved in, you know, a medical environment because you've got a disease process that's happening, there's lots of things that other people decide. What tests you need, what medicines do you need, all of these things are quite out of your control. But also one of the things that you can have a lot of control over is the physical aspects of therapy. So though you may need help and support to be able to understand what to do, it's something that can be really done to enable anybody to have better control over their disease process. So thinking about exercise and fitting that into the biopsychosocial model, exercise is absolutely vital in order to repair the damage done by an inflammatory disease. So myositis, the disease process is going to damage muscle fibers by causing inflammation, both in the muscles, but in the blood vessels as well. And that obviously has an impact upon function and psychological well-being and how that fits into social and family functioning. And so exercise can have a really positive impact on all of these aspects of somebody's life and somebody's, I guess, life with a disease. So first of all, what we're really wanting from physical exercise is how to prevent and limit damage. Because when myositis has started, this wasn't asked for, it wasn't wanted, but it has happened. And so what we need to do is to start with something that has become unwanted within your body. And what we need to do is find out how we can use exercise to the best of anybody's ability. And I guess the most important message is that exercise can be started immediately. It's very safe. There's been a lot of misunderstandings, misconceptions, and lots of worries about how and when exercise should be started in anybody's therapeutic management of myositis. And I think what's really important is that research is coming through and, you know, and is being done as we speak in order to prove that it's safe. But it's also more than being safe. So starting exercise is important, but it's also important because myositis is patchy. It doesn't happen all in one lot. It happens in different areas of muscles, muscle fibers, different muscles are involved to different degrees. And so what we also want to avoid by starting exercise immediately is to avoid disuse, atrophy, so wasting of muscles because you're not using them because other parts of the body may have a myositis. It's also important early on to keep exercising and start exercising, because movement maintains the range of movement of the joints. And what we want to do is prevent further harm or damage as much as possible right from the very early stages. And what we're also beginning to understand is exercise can be an anti-inflammatory as well as medications that people may be taking. But exercise not only is important right at the beginning to start preventing damage, but also it's important to make sure that as you move forwards in a disease process, that things are protected as best as possible. So making sure that you use exercise and thinking about posture and positioning of the body. So thinking about the correct posture and sitting and standing, and the correct posture will also help improve function. But also, if you've got the right posture, you can maximize the use of specific muscles and strength, stamina that you may have. So you actually pace activities better if you've got a better posture. And you'll also avoid an increase of experiences of pain if posture is better. If you're not able to control your environment and your posture, then you put lots of abnormal stresses and strains, increasing fatigue and pain. As we're aware, quite often in myositis, head control is a really big problem for people. And if you don't have adequate head control, then that has an impact on swallowing capabilities and respiratory function. So thinking about posture in order to maintain head control in the most safe and energy efficient way is also really important. And then moving forwards, it's also thinking about how can we make sure that people are safe. So safe in making sure that they're strong enough, they're fit enough, they have a paced approach to activities to prevent falls. Because when you have muscle imbalance and weakened muscles, it affects your balance, your ability to control your balance, and it also affects proprioception. And proprioception is your body's ability to be able to understand where it is in space. And when you're weak and you're running out of energy, it reduces saving reactions. So we need to put all of this together so that people are safe. They're safe to exercise, they're safe to eat, they're safe to function, but they're also not wasting energy because of poor positioning or abnormal use of muscles. And then what we also want to do is make sure that we don't end up causing problems. So we're wanting to really make sure that we prevent overstretching of ligaments. So again, this ties all of this back together, because if you're standing without using muscle control, often what then happens is that you stand using your ligaments to hold you up. So then you start putting extra stressing and extra stretch on the ligaments and the tendons, and then you can cause a change in range of movement, a change in posture, which causes more problems. And all of these things are very energy consuming. So we want to maximize energy efficiency as well as safety. So what we understand is that many causes of muscle weakness in myositis. So there's inflammatory causes. So these are cellular changes, they're damage to muscle fibers, loss of muscle fibers, change in the circulation, which obviously has an impact in the change in the energy supply actually coming to the muscles and fibers. There's influences of cytokines, influence of myokines, but also there's understanding that macrophages are very important in muscle function, and these are all affected by the disease of myositis. I'm sure there are many things that we haven't yet found out, and that's what those question marks relate to. But I think it's also important to remember that though this is an inflammatory disease, there's lots of non-inflammatory components. And so non-inflammatory happens secondary to the inflammation that's happened. So something called neural deactivation happens. So our brain and our body learn how to speak with each other. But if you stop using something, your brain sort of forgets that it it's there or forgets how to use it. And that's what's called neural deactivation. There's less efficient messages from the brain going to the muscles, asking them to work. You also get disused muscle atrophy, as I mentioned earlier. So if you stop using muscle fibers, they start to get weaker and smaller. And as myositis is patchy, that is more of a problem, because if you're moving less and doing less, then the healthy fibers will start to waste because of lack of use. What also happens is you end up with muscle imbalance. So some muscles are not so affected, so they stay stronger. Other muscles are affected more and they become weaker. And then you alter the way that you move with these altered movement patterns. And then this causes more muscle imbalance. Some muscles being stronger, other muscles being weaker. And what happens is the weaker muscles keep getting weaker, regardless of disease process, and the stronger muscles are used more, so they stay healthier and stronger. But that muscle imbalance causes a movement abnormality. And all of this contributes to having more pain and more fatigue, and it limits somebody's ability to perform their activities of daily living, to function normally, to be able to move normally, to be able to do the activities that they were able to do before. And as I mentioned, that also has an impact on your balance, your proprioception, and that understandably causes people to be more nervous about the physical activities they're doing, because they know they're not so balanced, they're not so strong, they don't have so much energy. And that fear is a very negative emotion to be experiencing. And so this all has a combined biopsychosocial effect on your mood, your thoughts and your feelings. And as we begin to understand more and more, exercise and movement are very important for our mental well-being and our health. And that's something that we've all learned over the pandemic and the lockdowns that we've all been through, where the less we're able to move and the less exercise and activity we do, the lower our mood becomes as well. So I just want to briefly touch on cytokines, less about the sort of science behind them, but more about how important they also are in muscle function, because I think sometimes it gets a little bit forgotten and people get a little bit too scientific, but actually cytokines have a really important role, because they not only regulate inflammation, but they also can initiate inflammation as well. But the way that they work, both normally in healthy as well as unhealthy situations, is really complex and really dependent on how they interact with each other. And these interactions also become much more complex with other types of cells. So the fibroadenopogenic cells are really important cells for developing fibrous tissues that we all need within our structures. And if the cytokine control goes out of balance for those, you end up with a more fibrous muscle and less muscle fibers. But cytokines also have complex interactions with satellite cells, and I'll talk a bit more about those. But satellite cells are the cells that we need to repair and replace our muscle fibers. And they also have complex interactions with other cells, macrophages, which are also really important for muscle function, but also muscle repair. So just coming back to some of the most common cytokines that we know about and we think about in myositis. So we're thinking about interleukin-1, so IL-1, and that has a really, both alpha and beta have really important normal muscle functions. But we also understand that TNF-alpha, which is one of the most common cytokines that we try and balance in treatments, but TNF-alpha is absolutely vital for controlling normal muscle regeneration. And how that works in normal muscle control is TNF-alpha promotes baby muscle cells to grow, and then baby muscle cells grow and grow through their life. And then when they become old and they become grandparent muscle cells, then TNF-alpha is really important for the apoptosis. So that's the programmed cell death of old muscle cells. So you need TNF alpha to be balanced to keep this normal control of regeneration of muscle, building new muscle, getting rid of old muscle. But what we know is that TNF alpha levels are increased in myositis, and this increased level of TNF alpha inhibits the way that the muscles are able to contract. It reduces the strength of that contraction, and it slows down that contraction. And it also causes the protein to be reabsorbed more quickly, so you lose the protein within the muscle, so the muscles become wasted. And as you'll find out in a minute, but exercise can help balance this TNF alpha levels, even within myositis. And then another cytokine, which is really important for muscle control, it's IL-6, and it's a pro-inflammatory cytokine. So it's understood to cause an increase in inflammation, but it's a healthy increase in normal muscle fibers. And it's normally produced by working muscles. And it's the cytokine that if you go to the gym and you work out super hard and the next day you start to be a bit sore and a bit painful, and in a normal scenario you think, oh, actually that's pretty good because it means I've worked well in the gym. It's produced by inflammation caused by a raise in IL-6. But in inflammatory disease, IL-6 is raised to a much too higher level, so it's doing too much of the role it has in causing inflammation in muscles. But actually we can again control the amount of IL-6 using exercise. So different types of exercise will have a more positive effect on controlling IL-6. So we need to be thinking about exercise that causes shortening of muscle fibers, and that works for longer periods of time, so endurance. And you need to start with like the right amount of effort and time to start with at the beginning of a disease process, and gradually increase that slowly and steadily in a very paced way, so that you can maximize balancing the controls of IL-6 as well as TNF alpha. But IL-6 is very important cytokine in ensuring that muscles get an adequate supply of food in order for them to metabolize. So they need the energy using IL-6. So moving on to satellite cells. Satellite cells are cells that are there within our body, and they're there ready for us to repair and grow muscles. So they're like baby muscle cells. They sit there undifferentiated, waiting to be stimulated. So what they're there for is to make new muscle fibers, repair damaged muscle fibers, make your muscles bigger if that's what you're wanting to do. And they're fundamentally stimulated to come into action to repair and to replace muscle fibers by exercise. So if you don't exercise a muscle that's been damaged and needs repairing, then the satellite cells aren't triggered to come back and do that repair. So this is why you need medication in order to control the disease process and switch it off, but you need exercise to not only help with that process of balancing out these cytokines, of controlling some of this inflammation, but without a specific exercise program, you won't stimulate these satellite cells to come back and repair these muscle fibers. And that's super important. And they also help produce, to help balance up these FAP cells that are, you know, what we don't want too much muscle fiber, but we want just enough to make the muscles like sturdy, and so they really help balance that out. So I guess the most important message from this slide is that without exercise you cannot repair muscles and help them recover after having myositis. So this is when we start to understand exercise is actually a medicine. So it's a medicine on many different levels. It's a medicine because it has an anti-inflammatory response and it helps balance the cytokines. The right amount of exercise improves immunity. It controls insulin resistance, which helps balance our levels of glycogen and glucose within our bodies. it's absolutely vital for the repair and the development of muscle fibers. You can't do this without exercise, and that's around the satellite cells and the macrophages. And then once you've thought about that from an inflammatory point of view, we need to exercise in order to increase muscle strength and muscle stamina. Exercise also helps correct this neural imbalance that I talked about before, so helps activate the conversation that your brain and your muscles have with each other. And exercise is vital for improving our aerobic fitness. Exercise also is vital for making sure your muscles are the right length, that you don't develop contractures or muscle tightness. And it helps therefore protect the joints and not do extra damage by adding abnormal forces. And then it will enable us to increase function, both aerobic function as well as activities of daily living. And it's important to promote development and reactivation of function, improve mobility, and improve also psychological health, which I'll just briefly mention. And I think what's really, really important, and the picture I think is something really vital, and it's something that I'm constantly reminded of, both in my everyday life, but in my practice as well, is that it's not what you do once in a while. So please don't think exercise is something you just do once a week. If you want exercise to be as a medicine, you need it every day. So you need to be doing this on a daily basis. So as I've mentioned, exercise is really vital for muscle repair. And it's not just any exercise. So I'm not talking about going and doing more walking or doing more running. It's about specific exercises. And that's about a moderate, progressive resisted exercise program. Now, this can be delivered in many different ways. So because there are thousands and thousands of exercises, and this is where you need to work with a physiotherapist, or where people need to work with a physiotherapist in order to be guided about how and when they put in certain exercises. And so, you know, from my perspective, you know, I have a certain way of how I prescribe exercises, but other people will have a different way that works for them. And it doesn't matter, because what you're wanting from your therapist is their understanding where your weakness is and being able to give you the right exercises for that muscle group. And one thing I've learned over the pandemic as well is that we were given access to an app that enables us to prescribe exercises over a video. So we can pick exercises and then set a video program for our patients. When this first came out, we had a choice of about 500 exercises, which I thought was pretty amazing. And now they've had time to progress this. The app has 27,000 different exercises. So guess what I'm trying to say is that it doesn't matter the exact how you're doing the exercise, because I might choose a certain exercise, but if your therapist is choosing a slightly different way, that's also absolutely fine, providing you know which muscle group you're targeting. But as I've mentioned, it's about the moderate, progressive, resisted approach to it. So starting with what you can do, but gradually making it more and more difficult. And then what we need to do is then to make the exercise even more technical. So once you've started with improving your strength and improving your stamina, this is where we need to then make sure that muscle fiber differentiation happens. So muscle fibers have different ways of working depending on where they are in the body and what their jobs are. And this is where a therapist is going to work with you around repetitions, about resistance, about working either concentrically or eccentrically, and using all sorts of different exercise techniques in order to make sure that the muscles repair in all of the ways that they need to function. And so I guess from my perspective, exercise principles about starting therapy immediately, making sure that it's, everyone's confident that it's safe to do this, but you need to be safe. So starting with what somebody can do. So start with what, the person is able to do, and then build from that. So start with a moderate program and progress it. I recommend starting with some specific muscle exercises before adding in more complex, and starting with resistance before you start aerobic. So so that you make sure that the biomechanics of the body are well supported before you start challenging them further. And it's building to higher repetitions. So because I specialize particularly in young people, it's working towards higher repetitions of 30 repetitions of each exercise that really challenges the stamina and the endurance of the muscles. And then adding resistance. That can be TheraBand, that can be changing your position, it could be adding weights. So it's a variety of different options that add in resistance. And evidence shows that regular exercise is much better than ad hoc exercise. And evidence shows that 4 times a week is better than twice a week. But actually, when you're dealing with a condition that's affecting you every day and all day, I would strongly recommend that, as I mentioned before, your exercise program or the exercise program becomes something that's part of your everyday or the person's everyday battle against their inflammatory disease, and making sure that the exercise program is regularly progressed until you've achieved what you need to achieve. So just very briefly, there are other benefits of exercise that I mentioned right at the beginning. So thinking about making sure that you're either regaining or maintaining joint range of movement, and that can be done with stretches, with thinking about your posture, thinking about strengthening into the full range of movement that's been achieved, and re-educating movement patterns. So gait re-education and movement re-education. And then I think it's really important to think about and to remember balance, because as soon as you start to lose strength or stamina, then your balance reactions tend to change. And so you need full range of movement, you need optimal muscle strength throughout range, you need good muscle stamina, need proprioception, and you need confidence with movement, and then your balance will be improved. And obviously it's in everyone's best interest to avoid falls and trips and potential, trauma to the body from these types of accidents. Benefit of exercise and managing pain and fatigue is also very, very well understood. And so recognizing that we're coming from a position where there's an inflammatory disease. Inflammatory disease itself will be exhausting and potentially causes pain. But once you start with pain and fatigue, then you start to limit your movement, and then limited movement, pain, tiredness tends to reduce people's mood. So you get fear and low mood, and then people do less. And then when people do less, muscles become weaker, you become less fit, and you end up with this spiral. Exercise has a positive effect on all of these aspects. So exercise helps improve fatigue, so it gives you more energy, it improves range of movement, improves our mental health, obviously gives us more activity, makes muscles strong, makes us fit, and exercise helps reduce pain. So even though there may be an inflammatory disease process going on, you've got these other components, and exercise will have a benefit with those too. So then it's really important about how we move that from being therapeutic into being much more fun. So how do we do that? And I think it's really important that, sport is, and playing and being functional and interacting with your friends and your family. It's important both for our physical health and our mental health. And this is where we just need to make sure that, everyone is strong enough to do the tasks that they want to do, they're fit enough, and it's something that they want to do. And, because, as I mentioned, I focus particularly in young people, it's encouraging non-contact activities before contact activities. Contact is where you're playing sport with other people and you can't control them. So football and rugby and those types of things. So non-contact means you've got control about how much and how fast. But we also need to improve aerobic function, and that's a very nicely done through sport and, physical activity. But it's about finding things that make sure people are included and not excluded. And that might mean thinking outside of the box on the types of activities and the way that those activities are done. And then I think it's really, really important just to remember how important exercise is for our psychological well-being. And so there's lots of evidence that shows how important exercise is to lift mood, to treat clinical depression, to reduce anxiety and fear. Exercise and participation in special, you know, both individual and group sports helps increase self-esteem and confidence, and also helps create a sense of autonomy about what you're doing in your life. And I think exercise is a really, really powerful way of changing hopelessness and helplessness into self-help and confidence. And it's about regaining control over recovery. And I've just put in here about a friend of mine called Myositis Joe. His identity has changed a lot since he's developed myositis. And when I first met him, he was very unable to do many physical things. He could barely walk. He needed lots of splints and walking aids. And he was terrified of how much to do. But since he's understood the power of exercise, he has taken it, to a level that is beyond, beyond imagination. And he's gone from, he doesn't need splints anymore. He can walk a really good distance, like much more than probably I can walk. And his most recent achievement has been that he can now get on and off the floor independently without help. And that has not been because he's changed his medication, and it's not been because his disease has gone away, because it certainly hasn't. It's because he's used an exercise treatment to be able to regain a lot of this function. He still obviously has difficulties, but he's overcome and changed a lot of his difficulties. So I guess in summary, it's really important to understand that exercise is safe right from the very beginning, but to start where you can start. And exercise should be seen as a medicine. So it should be seen as part of the control of disease of myositis. And therefore, the more it's done, the more effective it's going to be. Exercise is going to have a positive biopsychosocial effect, and it can make sure that people become included in more activities rather than feeling very isolated, because there are many ways of doing different exercises and it can be fun. And I think it's really important that it becomes part of normal life. It should be part of, it should be part of everybody's life, but it just may need to be targeted and specific. But exercise is empowering, and it also gives control back to the person who really needs more control in their life. Thank you.
Thank you, Sue. This was wonderful to hear. Very interesting. We are very, very late now, but if there's somebody who has some questions on the chat, so we can see, see for a while. Otherwise, I have problem to get contact with Helen. She's looks like I have thrown out her from the as a panelist. So I will have some discussion with her how we're going to do with her part. So I have some question here. Do you see this chat file, Sue, or shall I read up this? High repetitions only in the beginning is the question here.
So no, I would always start with what somebody's able to manage. So, start with low repetitions, and it may not even be able to be against gravity, for example. So start with whatever somebody can do and build up from that. But you're aiming to build up to higher repetitions. So if you only do 10 repetitions of an exercise, then there's a ceiling effect of how beneficial that is. But the benefit above 30 repetitions, there's really very little benefit. But there's enormous changes and benefits going between 1 repetition and 30 repetitions. So that will continue to give a benefit. And when you get to 30, after that, there's very little increase in benefit. Does that make sense? So start with low repetitions and increase to these 30 repetitions. And then there's many other ways of making the exercise more difficult.
Okay, thanks. Thank you. Cecilia is asking, thank you. Would it be possible to have your presentation to discuss show to physiotherapist?
Yep, I'm more than happy for you to
actually
have my presentation.
Helena Alexanderson actually has been listening to this also before, so she's aware about.
Absolutely, and Helena and I work very closely together.
Yeah, so I thank you very, very much, Sue. And I'm going to say this in Swedish now.
Is it okay if I leave you because I won't understand a word of what you're about to say? So
yes, thank you.
Nice. Thank you so very much for inviting
me. Could I just say something also? Yes, could I just say something also?
Of course.
Yes, I listened to this very nice talk. Thank you. And I think it's tremendous to see all this, how positive it is, and also this this important effects of exercise on inflammation, and I really how you presented this. I would wonder a bit, because you didn't say too much about your own practice. So what is your how do you treat the patients in collaboration with rheumatologists?
So my specialty is particularly my specialty is particularly with younger people, and so I work within a multidisciplinary team, and we're very fortunate that we have a facility where we can have young people coming to the hospital every single day for physiotherapy for a short period of time. So I have a flexibility of seeing a patient and setting a home exercise program, so they do that for themselves. And I have the ability for them to come to the hospital every day and we help them do their exercises. If they come to the hospital, they will exercise for between 2.5 hours and 3 hours a day. So it's a very intensive program. And even with young people that are extremely weak, they will still do a large amount of exercise, but at their level, so that they can recover quicker. And what we found is that the sooner you start exercise, the quicker they have positive outcomes, the quicker they get better and the more functional they remain. And, you know, within my roles within more international settings, I'm working with Helena as well, even in adults, when they start taking on these same philosophies of building up the higher repetitions and putting exercise in as a big priority of what they're doing every day, the recovery and the repair that they've also facilitated in themselves has been spectacular. So I've seen it in younger people and older people. Did that answer your question?
Yes, and just a short question. I thought to present myself. I'm John Lampa. I'm a rheumatologist and head of the department in Karolinska, the rheumatology department. Yes, so what is your opinion then with inflammation and exercise? Because if the patients may be high inflamed, it's a question how you would then justify the exercise, and I know that has been changed over the years. But what is the current opinion if you have a high inflammation in the muscles? Should you still exercise with these repetitions that you're discussing, for example?
Yes, absolutely. So this is where we go back to using the right type of exercise. So when young people have come with very high levels of inflammation, we start exercising straight at that level, but it's what they're able to do. So say, for example, they're only able to, you know, lift a little bit. We would help them do that a little bit more, but they need to move and they need to keep exercising. So we start at the level that they're able to do, but right from the disease beginning. And what we all find, you know, the medical team and the therapeutic team, is that by adding the exercise in right at the beginning, with starting the disease-modifying drugs and the steroids, they get a much quicker and better response to the medicines, and the disease settles down quicker with doing the exercises from the beginning than just waiting. Because when I started many years ago...
You answered my question, because that was my next question. Very good.
Okay.
Yes. Yeah.
So, and
how that can potentiate the effects of the drugs.
Yeah,
that is extremely important.
Yeah, and it prevents damage as well, because I used to, you know, years ago, as you just said, where everyone was scared about exercising in inflamed muscle, and so, you know, people were left lying in bed waiting for the disease to be controlled, and then would be passed over to a therapist, but they had contractures, they had massive amount of wasted muscles, they, you know, lost the ability to sit up, lost the ability to function, so you had to correct a whole ton of damage. And what we find now, by starting right at the very beginning of the disease process, is that there's very little correction of damage to do, because we're preventing it. So actually the outcome is you know, is a million times better. And many of our clinics, you wouldn't even know that the young people had a disease. Whereas clinics 20 years ago, you would have been able to spot them in the corridor. Now people come and they go, oh, I didn't know these, you know, these young people were unwell.
Thank you very much. Yes.
Fabulous.
Thank you so much, Sue. It sounds fantastic, what kind of work you are doing. So
thank you. There's a few questions in the chat, so before I go, shall I just answer them?
You can choose if you have the possibility. So.
Of course I do. Yes, absolutely. Okay. I'll just answer the few questions while you carry on. Is that okay?
Okay. There is one question from Cecilia. How much time do you estimate to spend in a normal Count Daily program?
Do you want me to answer this out loud or write it?
Yeah, you can. Yes, please.
Okay, so I guess realistically, I wouldn't set an exercise program that lasted more than 30 minutes, because people won't do it, and they've got lives to lead. So this is, you know, that's the problem with therapy, is it's time consuming. But I would set something that was around 30 minutes. But that 30 minutes is a great investment in time, because it means that the rest of the day you'll be able to do more as well. And then somebody's asked about the fact that they became unwell in August, and they've just had the diagnosis, and they'll meet a therapist within 2 weeks. That's perfect. That's fine. That's still quick. I mean, we understand that there's, you know, systems to go through, and so this is still early on, and, you know, getting started with the exercises with, you know, within that time period, it should be fine.
Okay, I think we can stop here now, so
yeah, sorry.
we can go forward. Thank you very much for your presentation. And now I changed the language anyway. So